Artificial nutritional support. When oral nutrition is contraindicated because of the risk of aspiration or is inadequate to meet nutritional requirements, then some form of non-oral feeding becomes necessary. There are basically two non-oral routes. Nasogastric feeding and gastroctomy feeding. Nasogastric feeding. Nasogastric feeding is quick to initiate and is often used in the early days after an acute event, such as a stroke or brain injury, when the individual is unable to take any or little oral nutrition. There are now highly durable, fine-bore polyurethane tubes that are easy to insert and reasonably comfortable to have in situ for a few days. However, there are significant problems with nasogastric feeding. Many people find the tube uncomfortable. The tubes often need replacement, and re-intubation can be upsetting as well as a potential cause of nasal trauma. Other disadvantages include blocking of the tube, displacement of the tube, and indeed the nasogastric tube itself might further impair a defective swallowing mechanism. Percutaneous endoscopic gastroctomy. In recent years, PEG feeding has gained wider acceptance as quick and safe alternative to surgical gastrectomy. There is no need for general anesthesia, and insertion of the tube is a simple procedure, just requiring a local anesthetic and sometimes a short-term intravenous sedative. There is a very low complication area of more than 1%. Tube can be placed under radiological direction or more commonly by assistance with an endoscope. The tubes are well tolerated and there is less risk of tubes becoming blocked or being dislodged. Tube feed can be administered either by bolus or by continuous pump. Sometimes overnight feeding via a pump is useful in supplementing an inadequate oral intake. However, for those who need most or all of their nutrition through a tube, then bolus feeding is generally best, as this has the advantage that the patient is free to be more mobile for large parts of the day. Usually, boluses are administered at 4 to 6 hours, so indeed at normal meal times. Usually people can tolerate 200 to 400 milliliter of a feed at a time, which will require just 3 to 4 feed per day. Liquid medication can also be given down the tube. Problems. Other than problems with the tube itself, such as blockage and dislodging, there are a number of common problems such as diarrhea, abdominal pain, abdominal distension, gastric reflux, and vomiting. Sometimes it can be quite a long process to adjust the feeding regimen to reduce such symptoms to a minimum. However, PEG feeding is usually easy and safe and is now widely practiced for many people, both in short term following a recoverable condition such as stroke or brain injury, or in the long term for those with permanent swallowing disorders such as those with multiple sclerosis or motor neuron disease.